I'm Dr. Jeremy Cauwels, and this is my blue chair story. I grew up in a little town called Hawarden, Iowa. It's right on the river, separating South Dakota and Iowa. My family was pretty, I would say, normal. It was me, my sister, my parents. We had a dog. We lived about 45 miles from here. The only real difference was probably that I was born with congenital heart disease. So I had a heart defect that I knew about from very close to the time I was born. And so from right out of the blocks, they knew that I was going to be going for testing, that they were going to be doing studies, and they were going to be making sure that my heart was growing and forming as normally as it possibly could, up until the point where I may need a surgery to fix it. Now, I wouldn't have noticed anything else was different, except for the fact that everybody who ever listened to me always went back and looked at my chart right after they did it, because they wanted to know if somebody else had heard that first. Up until I was 21 years old and had it surgically fixed, my heart never sounded normal. It sounded much more like a whooshing or a machine than the lub-dub that most people hear every time when they listen to a stethoscope. I received my treatment for the congenital heart disease at the University of Iowa Hospitals and Clinic in Iowa City, which was 5.5 hours from where I grew up in Hawarden. I think the one I remember best was probably when I had to go to Iowa City for a procedure when I was 5 years old. The part that was interesting for me is at 5 years old, I'm able to remember the doctors I had, the nurses I saw, those sorts of things. I even remember the fact that the doctor that I had showed me where the defect was in my heart. He had what I would call a coloring book of a heart. And he had one of those multicolored pens, the one that has 4 different colors and you can just push it with your thumb to get it. And he showed me where the hole was and drew it in color on there. Now I gotta tell you, as a kid, that pen was the coolest thing I had ever seen. I think the most important part about care in general is that we meet people where they are. If there's one thing I can tell you about a family travel for a kid's procedure at age 5 is that both parents take a couple of days off work. Both parents have to have the flexibility to make sure that they can be there when the kid needs to be there as well. And that's very different than I would have to do today if my child had to have the same procedure. It would be less than a half day off of work for me and a 12-minute drive there and back. And so the difference between that and 2 to 3 days off, if I had to drive somewhere else, if I had to make that 5-hour trek, is absolutely a game changer. And it's meeting our patients and it's meeting their families where they're at and bringing the care closer to them. I think those long-term relationships with specialists are really the things that help families adjust. You know, when you started, you knew you wanted a perfect baby. And then when you found out the baby wasn't perfect, all you really wanted to know was, can somebody lead me through this? Can somebody help me understand? And it really made it much easier to know that I was going to be working with the same doctor throughout all of those years. When I finished my residency and came to Sioux Falls, which is the first place I started practice, I established my care here with a pediatric cardiologist. Teresa Stamato is my cardiologist to this day and still follows me and keeps me up to date on my tests. When I went to her office, I sat as a joke in the chair that I would have sat in as a little kid. And so my blue chair story is right beside you with my pediatric blue chair. And I think it's important to know that when I sat in that blue chair in Dr. Stamato's office, I'm a little over 6'4" tall, and I was wearing my white coat and wearing my tie and my button-down shirt, and I was sitting in that little chair when she met me. In fact, for a couple of the appointments I've made, I've sat in that little chair when she's met me, and she still thinks I look ridiculous in that little chair. I look like a really big guy in a really little chair. My only concern at this point is that I'm 45 years old, and I don't know with every decade that passes how much longer I'm going to be able to get up out of a chair like that. This blue chair is definitely an upgrade compared to the little blue chair. It's much more comfortable.